This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. Thanks so much for joining us. We got a lot to talk about today. We begin with the business, the politics, and the policy of the Omicron variant of the COVID-19 coronavirus. I caught up with Dr. Cam Patterson, UAMS Chancellor, for a conversation. Dr. Cam Patterson, UAMS Chancellor, always good to visit with you. Thank you so much for making time in your busy schedule.
Great to be here. I hope you're not going to get me in trouble with anyone.
Well, no promises on that front. Let's talk about the Omicron variant, which is dominating the news headlines right now. I'll just tell you personally, I feel like I still don't know a whole lot about it. And are we overreacting? Are we just being cautious because of what we've been through, obviously? But what can you tell us is fact and what is fiction?
Well, what is fact is that this is a new variant. It's very unlike the Delta variant or any of the other variants of COVID-19 that we have seen before. There are more mutations in spike protein. The thing that we don't know is what actually does that mean? Is it more transmissible? We don't know whether that's the case or not. Does this create a worse or less severe form of COVID-19? We don't know that for sure yet. And does this confer any resistance to the vaccines which are very, very effective against the other variants that we know about? We don't know that either. So there are a lot of unknowns. What we do know is that it is spreading globally. It's now in the United States, it's in Canada. It will eventually get to Arkansas. I suspect before the next week or two is out, we'll start detecting this variant here in the state of Arkansas. And because there's so much uncertainty, it's difficult to know how to react. I think the basics still apply: masking, social distancing, and for God's sake, get your vaccine. But a lot is going to remain to be determined, and I think playing it safe for the next couple of weeks until some of the questions that we can't answer right now are answered. That's probably the smart move.
So you're not only a physician, but you're a public health official. Tell me what you think is the time frame for getting those answers. You know what the process is for having enough in the threshold to be able to make some assumptions and back them up with evidence. What do you think we're looking at to say we now know much more about this because of these things we've done?
It's really not going to take that long, Roby. I think we'll have pretty good answers to the unknown questions within the next couple of weeks, certainly before Christmas, the Christmas holiday. I think the idea of being cautious, I think the plan that President Biden has put into place seems reasonable to me. Let's don't overreact, but let's also take this as a moment to hit the pause button until we have these answers. But keep in mind, in Arkansas, the Delta variant is getting worse right now, and that's really the thing that we need to be focusing on more today than anything else.
And we know that the vaccines do work against the Delta variant, or at least there's a big efficacy component there.
The vaccines are nearly 100% effective in preventing death or severe illness caused by the Delta variant in people with normal immune systems. So the vaccine is still your number one ticket right now for safety here in Arkansas.
You and other hospital administrators, healthcare system operators have been on a yo-yo with the vaccine mandate that the Biden administration put into effect. It affects the way that you can utilize Medicare and Medicaid. That's kind of the heavy stick there that controls you on that. State law says you're not supposed to follow a vaccine mandate. So you've been in this world where you've had to straddle two different masters, for lack of a better kind of comparison there. Tell me where things are now. Is it easier because there's a stay in that vaccine mandate at the federal level now, so it's easier to do what you need to do? Tell me about the politics of how this plays out for you and some others in your shoes.
Well, for UAMS, we were caught between a rock and a hard place, between state law that we respect and abide by, and by the necessity of getting most of our clinical funding from CMS for Medicare and Medicaid services. The federal interim final rule, precluded our participation in Medicare and Medicaid if we did not have and enforce a vaccine mandate. That's would be $600 million off the top line for UAMS, which would cripple us, essentially put UAMS out of business. And so we did go down to the legislature. We had good conversations with the legislative council, and before we collectively, the legislature and our other participants in the state had to make a firm decision. A judge in St. Louis did put an injunction on the CMS interim final rule. I hope that this buys all of us some time. I hope it buys CMS some time to think through the position that they put UAMS in the state of Arkansas in. And I hope that this also gives us time to educate people across the state about what we would need to do if such a final rule was continued to be promulgated, if the injunction was overturned, if the federal courts decided that this was constitutional for CMS to make such a mandate. A lot of this is happening at a level higher than the one that I operate in, but it affects 3 million Arkansans, and that's a situation that I think is deeply unfair to the people of Arkansas.
All you want for Christmas is a faster legal system. I hear you loud and clear there. Let's talk about an update on the Cancer Center, particularly the NCI, the National Cancer Institute designation that you've been pursuing for a couple of years now. There have been a few little, press releases I've gotten of some advancements that are being made, some funding that's come through, some initiatives that are underway. But how much closer are we now to NCI designation, and what do you see as the remaining hurdles?
Well, we're a lot closer, and a lot of that is due to the support of the community. We've raised over $15 million in philanthropic support for the Winthrop Rockefeller Cancer Institute, and then on top of that, as you know, Roby, we had the marijuana tax money that Governor Hutchinson and our state legislators have provided to the Rockefeller Cancer Institute in our pursuit of National Cancer Institute designation. Let's remind everybody what this means. This means providing drugs and new therapies to people in the state of Arkansas for the first time that are only available at NCI designated cancer centers. It's about $10 million in additional National Cancer Institute funding, but it's about a $90 million boost to the economy of the state of Arkansas every single year if we get NCI designation. So it's a really big deal. And Michael Beer, who's the director of the Winthrop Rockefeller Cancer Institute, has just done an amazing job of pushing us forward. He, over the past year, has recruited over 18, probably will be somewhere between 20 and 30 new cancer investigators at UAMS. We are now within spitting distance, less than a few $100,000 a year, in the $10 million a year threshold of extramural cancer support that's necessary to be able to put in an application. And the one area where we need the most work on accruing patients into cancer clinical trials, we're almost halfway to where we need to be, but our pace there is accelerating. We've got a statewide cancer network in place. We're working with community members. We're working with people who historically have poor access to cancer care. All those things are going very well. We won't be putting an application in the next year, I don't think, but it's not that far away. And we're going to make sure that we have every I dotted and T crossed before we put in the application so that we're 100% confident that we'll bring home a National Cancer Institute designation to the Winthrop Rockefeller Cancer Institute when we drop our grant application.
Maybe you can ask for that for Santa Claus next year, Cam. So,
if Santa Claus brought home everything that we needed to put an application in next year, the kids are going to be happy.
All right. Dr. Cam Patterson, always a pleasure to visit with you. Thank you for your expertise and for sharing with us.
You too.